Own Way, the podcast with me, your host, Corey McClurg. Welcome back to another episode of Get Out of Your Own Way. I'm Corey McClurg. Today we are going to talk about some common myths in kind of the health world. I probably should have done a podcast about how research is done. I'll do that. I'll put that on the list to do. But suffice to say that, that all of these myths that I'm going to go through are evidence-based. I'm not just here to make stuff up and and just, I don't know, hear myself talk. But yeah, so there is rigorous research that has gone into to all of this, to what I'm going to convey today. And at some point I'll do a kind of hierarchy of research podcast. Suffice to say that, using our own critical thinking is really what we need to do whenever we're approaching this just barrage of crap that we see, in the media, whether that's social or otherwise. There's a whole host of reasons why these myths are pervasive. And we'll go into that at some point. But suffice to say that, there's a lot of myths out there. So I'm going to go through a lot of the pervasive ones, and, some of them are probably going to kind of piss you off. And I'm sorry, that really sucks, because, it's not your fault. It's not my fault that these ideas, just get spread around. But let's, I'm all about transparency, and I'm all about digging down and figuring out the truth. So let's just dive in and, start to do that. So the first myth is that disease is inevitable. Disease is not inevitable. And, we think that because diabetes, high blood pressure, cancer, all of that runs in our families, that we are bound to get it as well. But it's our diet that is the leading, as in the number one cause of premature death and disability. And, one of my favorite doctors, Dr. Caldwell Esselstyn, he has this great analogy. He says, genes load the gun and lifestyle pulls the trigger. Overall, genetics plays this very small role in our health. So much smaller than really most people believe. One example is that there's quite a bit of research that demonstrates that obese people who have the lowest genetic risk for diabetes were actually 5 times more likely to develop diabetes than normal weight people with the highest genetic risk. So lifestyle trumps genetics, right? So let's say that again. If normal weight people who had the highest genetic risk, right, they're less likely, even though they have a high genetic risk, they are 5 times less likely to get diabetes than people that are obese who have the lowest genetic risk. So it's not about what came in our bloodline. It's about what we are today, right? And obesity is a huge risk factor for all kinds of disease. And actually, that's something we're going to go over in a little bit. There's this wishful thought that when we abuse our bodies, that we're just kind of cutting off a few years of our life. The myth goes something like, hey, we're having fun, enjoying, everything, eating whatever we want, drinking whatever we want. And, and we're just able to do everything, do all this fun stuff. And then all of a sudden we just kind of die peacefully, in our sleep at age 78. And of course, the truth of the matter is that people experience greater and greater disability and infirmity, and it just culminates in their final years where, they're relying on other people like nursing home staff or spouse or even their kids, to do like the basic stuff of life. They're having to like change their diapers and feed them. And even earlier in life, like the quality is impacted by the need for expensive, lifelong medications, or we just can't physically do activities that we like. Like sex is a perfect example. Erectile dysfunction is preventable. I know we all think that just comes with age, but it doesn't. The penile artery is affected by the same gunk that our coronary arteries are. So anyway, this whole idea that disease is inevitable is a total myth. Another myth that I hear a lot, this kind of attitude, is that, hey, my health is my own business, so butt out, right? But your health is very much a public issue, and it's not just an individual burden. As an example, we've known since the 1930s that type 2 diabetes is very much preventable. And if it's not preventable, then it's actually reversible with diet. And yet, the cost of diabetes alone is over $412 billion in the United States alone. People with diabetes spend on average nearly $20,000 a year on direct medical costs. And, if you understand how insurance companies work, these costs are not just the direct burden of only the people that have the disease. We all share these costs in the form of higher premiums, not to mention, uninsured or government programs like Medicare, Medicaid, which are funded by taxpayers. And, if you have diabetes, then you're more likely to have hypertension, heart disease, vascular disease, or even depression. So a person's lifetime cost of disease is easily in the hundreds of thousands of dollars, even if they don't experience a major episode requiring hospitalization. Once you add a couple of hospital stays, tests, procedures, that number can exceed millions of dollars. And diabetes is just an example. 90% of the $4.5 trillion spent in annual healthcare expenses in the US went to chronic conditions. And these conditions include heart disease, stroke, cancer, diabetes, obesity, arthritis, Alzheimer's, all of which are preventable and treatable with dietary interventions. This chronic disease epidemic, it's very much a public health crisis, and has very public implications. It's not just this individual burden. Another myth that is probably really going to piss some people off is that cancer is bad luck, and it just has nothing to do with your lifestyle. I don't blame you that this one pisses you off. Many people, many of us have lost loved ones due to cancer, or even been, cancer patients ourselves. But don't shoot the messenger on this one. We are suffering from a situation in which healthcare providers aren't giving us all the information, and there's a slew of misinformation sources, like industries with a vested interest in keeping us confused. And doctors are people too. They use substances like alcohol that cause cancer, and they struggle to convey the facts because they are enduring cognitive dissonance. I've talked about cognitive dissonance here before. We have to take responsibility for our own health and really kind of dive into these facts, because it's not necessarily just common knowledge, unfortunately. And some of these facts are that, due to overwhelming research and just compounding evidence, the World Health Organization has proclaimed that up to half of cancer deaths are preventable. Half. 3 huge longitudinal studies, which was the Harvard nurses study, the Harvard Health Professional follow-up study, and the NIH AARP study, followed over 700,000 people over decades. And the major conclusions were that even when you factor in age, weight, alcohol consumption, exercise, smoking, family history, poor diet is associated with an increase of dying from cancer. Alcohol is classified by the World Health Organization's International Agency for Research on Cancer as a Group 1 carcinogen. That means it's causally linked to 7 types of cancer, including esophageal, liver, colorectal, breast cancer. Alcohol consumption is associated with over 740,000 new cancer cases each year. It's also worth mentioning that alcohol is toxic, it's psychoactive, and it's dependence producing. And, you might be thinking, well, I don't drink that much, so I'm fine, I'm out of the woods. But the research shows that even light to moderate alcohol consumption has been attributed to over 13% of all alcohol attributable cancers. And of those, a third were attributed to just light drinking. And so, when you're ingesting, it's a literal toxin, it just doesn't take that much. The World Health Organization has also classified processed meat as a group 1 carcinogen. And so let's break that down just to make sure, all of us regular folks know what this means. So carcinogen, that means cancer causing. And then group 1 means that the substance has been shown to cause cancer. And when I say processed meat, that includes stuff that people eat every day, like bacon, hot dogs, ham, sausage, corned beef, beef jerky, lunch meat. It's really kind of mind-blowing. I mean, this is stuff we feed our kids every day. And so it's totally bizarre to me that we're not talking about the fact that, that your Lunchable contains something that's a group 1 carcinogen. I just don't understand why we're not talking about this. Of course, anybody that has ever eaten a hot dog, doesn't get cancer, but it's just absolutely insane that it's so commonplace. And the evidence is so strong that it made it to this group 1, per the World Health Organization. That's a really high bar. Processed meat is right up there with smoking and alcohol and, other nasty stuff like asbestos and benzene and plutonium. They have all different rates, right, of incident, but the causal link is there. And I hate to kind of keep beating this drum, but again, I can't believe that we're not talking about it more. So in addition to processed meat being a group 1 carcinogen, red meat broadly is in the group 2A, which means it's probably carcinogenic to humans. The 3 longitudinal studies that I talked about earlier, they specifically found that red meat consumption is associated with cancer death. And the amount of scrutiny that's levied on WHO in creating these recommendations is significant. This isn't like the latest, headline of of, the New York Post or something. And just so we're clear, red meat is meat coming from mammals. So that's beef, veal, pork, lamb, mutton, which is sheep, horse, goat. And, the thing that is wild, right, is that it's not uncommon for people in the US to have sausage at breakfast, a burger at lunch, and then, a steak and wine at dinner, or maybe, have a couple of hot dogs at the ball game with a beer. We're just orally inundating ourselves all day long with these cancer causing toxins, and, we call it food. So yeah, no, we can't attribute cancer to just bad luck. We're kind of making our own bed here, with every single meal. So I got another myth that I know is going to piss some people off, and I'm so sorry, but so the myth is that you can be healthy fat. And for sure the culture in the Western world subjects people, women especially, to harsh criticism relating to every aspect of their bodies. To be a woman in the US means that you have to be incredibly thin and beautiful and fashionable and young. And, if you're not, then that invites all kinds of trolls and just horrific responses. Not just from the outside world, but, from inside. We do it to ourselves because we grow up in this culture that expects perfection. I can't convey strongly enough that criticism is disrespectful, it's hurtful, and it's not helpful. And also we can be cognizant of the fact that being overweight does increase the risk for every lifestyle disease. Both things can be true. That vain, harsh criticism of people is unacceptable, and that being overweight is also not healthy. It's not fat shaming to state a fact that has been established from vast clinical research. But also shaming ourselves about being overweight is counterproductive as well. As I talk about in lots of other avenues, it's really acceptance and compassion that's the way to effective change. And, obesity is a medical condition. It's not a moral judgment. But I understand how it may feel that way, that it is a moral judgment when, it seems like everyone has a bias against people with obesity, and, the research bears that out. And the stress associated with weight stigma is very real and can just create this vicious cycle of, unfavorable health outcomes. Reversing the epidemic of obesity would add more years to life expectancy in the US than curing all cancers. That's how impactful obesity is. Being overweight increases your risk for diabetes, cardiovascular disease, high blood pressure, high cholesterol, and cancer. And these diseases are life-threatening. Obesity and being overweight, these individuals have a significantly greater risk of dying prematurely. We now have a better understanding of why obesity increases our risk for these other diseases. We know now that fat's not just an inactive, storage of excess energy. White adipose tissue, that's the fat that you normally think around your gut and various other unpleasant areas. That's now widely considered to be a major endocrine organ, actually. It releases hormones that regulate such functions as glucose and lipid metabolism, your immune system, and your vascular health. The bottom line is that being overweight is not a vanity issue. It's a serious medical condition. All right, so another myth that I want to bust here today is that nutrition information and research is confusing and conflicting. So, I'll concede that the reports that we see in the media are confusing. That is for sure. The news media is often trying to capture eyeballs, and sensationalism is what attracts our attention. The issue of getting real facts has gotten even worse since anyone can publish anything, for any reason on social media outlets. No one's held to any standard in the social media world. And the data, though, is actually very clear about what foods are healthy and what are not. However, the food and beverage industry has been actively working to keep the public confused. There is published data, peer-reviewed research on this. The current situation with the food industry is actually very similar to the tobacco industry in the early part of the 20th century. Lung cancer used to be extremely rare in the early 1900s. Smoking was an anomaly, but it was already known to be associated with tobacco use. But the use of tobacco really began to increase after the invention of the automated rolling machine. The mechanization and automation, made that ready to smoke tobacco commercially viable and hence, more prolific. Prior to that rolling machine, cigarettes had to be rolled by hand. But now with the rolling machine, they could be, cheap and easily pushed, this dramatic increase in smoking rates. And so did lung cancer rates increase with that increase in smoking. Some of us can remember people still smoking, like chimneys well into the 80s. But the tobacco companies, they knew that their product caused cancer in the early 1940s, and even by the mid 50s, tobacco companies' internal communications described the evidence as overwhelming. Literally, it says overwhelming. This tie between smoking and lung cancer. But, in the environment we live in now, none of us even expect for a company to tell the truth about their product, especially when it's making them billions of dollars, even if it's killing people. And, even if we don't expect tobacco companies to tell us the truth, then, surely our doctors would tell us, right? No, doctors are people too. Research available to the public was available for decades about smoking. And when the Surgeon General issued a report that smoking causes lung cancer and probably heart disease, he issued that warning in 1964. There's a press conference, and he just very, very plainly said, "Hey, smoking causes lung cancer, and it probably causes heart disease." And despite here it is, like the top doctor in the States, sounding the alarm. The American Medical Association continued to accept advertising dollars from the tobacco industry in the Journal of American Medical Association. AMA refused to endorse the Surgeon General's report, probably likely coincident because they accepted a $10 million gift from the tobacco industry right about that time. And, the government's really no better. Congress continued to provide subsidies to tobacco farms. Those subsidies, by the way, continued until 2004. But even then, tobacco producers received an additional 10 years of transition support. And to this day, tobacco farms still receive benefits like government-backed crop insurance. And, I think we kind of all think like, well, that was like 50 years ago, so things are better, right? But no, no, they're not. The processed food industry actively works to keep people confused. You might remember an issue of Time magazine featuring butter on the cover with, there's like this big swirly pat of butter. And I think the title was like Eat Butter. A couple of years later, they have this article, The Case for Eating Butter Just Got Stronger. If you really get into the research that they're talking about, it's insane. First of all, the supposed case, even in this research, is actually an increase in your risk of death for each additional serving of butter that you eat. But the increase that was shown was fairly low in their opinion. So, they make the argument that you might as well eat it. But, the truth is that numerous studies have shown that decreasing your saturated fat, which is what butter is, that decreases your risk of cardiovascular disease, and increasing saturated fat increases your risk of cardiovascular disease and death. So, why didn't Time Magazine report on all this other research? Well, I maintain that we like to hear good news about our bad habits. I didn't come up with that quote, by the way. I believe that was Dr. John McDougall. So talking about this, kind of shady study that really cherry picks one source of saturated fat out of many sources of saturated fat that people are putting in their bodies. Well, that sells magazines. And, not to be outdone, it's not just butter or a dairy that does this. There are other studies like the Mars company, of Mars bars, and the Kellogg's of Frosted Mini Wheats fame. They funded similar studies showing improvements in children's attention span and the ability to focus when they were fed candy or sugary cereal. Which, that's just unbelievable, right? But guess what? The control group was in this study. The control group ate nothing. So the parents were literally instructed to send their kids to school hungry. So yeah, compared to hungry kids, the kids that ate sugary meal did better. You can't make this stuff up. It's kind of insane, right? So, these are just a couple of examples of the kind of bad faith research that goes on and gets picked up in the media. We see headlines like candy is good for your kids and eat butter. And even if you question some of the details, you might subconsciously start thinking that it just doesn't matter. If you eat candy and butter, and that's simply due to a kind of a public influence effect. So for example, people of a certain age might recall that First Lady Nancy Reagan, launched the Just Say No campaign in the 80s. And the idea was to give kids the words to use when they're offered drugs. But those of us, that lived through Just Say No kind of realized the problem from the beginning. The ads inferred that we were just like in constant danger of being pounced on, by drug dealers, on every corner, and just kind of like handing out free drugs, and our only job was to just say no. And so, yeah, even our kind of thoughts about this campaign was demonstrated in actual research to be a failure. On the whole, kids exposed to the ads use drugs at the same rate as kids that didn't see the ads. And in some trial groups, the kids that saw the ads actually used more drugs than the control group. So, why does this happen? Well, it's this kind of public influence effect. Sometimes we think, if we think that there are so many people doing a thing, then we think it must be okay. So if so many people are doing it, then surely it's not that bad. And this happens with other aspects of your life, including, your diet and alcohol. And one of the other risks with this kind of insidious thinking is that if you think that there's so many other people doing it and they seem fine, you start to think that it's just a problem with you. But really, so many other people have a problem. So many people have diabetes, they have cardiovascular disease, they have cancer. Um, it's not just some dysfunction in, your own body. It's what, we're putting in our mouths by way of this totally effed up food system. And, like I was saying before, it's not just normal people that get caught up in this. Healthcare providers are not immune from these human factors that are involved in misinformation campaign. American Academy of Family Physicians, American Academy of Pediatrics, American College of Cardiology, they only stopped accepting sponsorships from Coca-Cola as late as 2015. And it was known well before 2015 that sugary beverages like Coke were causing an array of health issues. And, in addition to trying to wiggle their way into influence, we know that the food industry directly pays for influence. The Washington Post reported on a recent campaign by a food industry organization, which involved paying healthcare influencers to post on social media to dispute valid concerns from the World Health Organization. WHO had started issuing concerns about artificial sweeteners in the summer of 2023. And then several dietitians who were paid by an industry group called American Beverage, they started posting videos to dispute the claims of WHO's claims and profess that it was just fear-mongering on the part of WHO. I mean, talk about some, cojones. I just to try to sow these seeds of doubt from a group like WHO is just, unbelievable. But again, this is just an example of the food industry sowing seeds of doubt. They have the gall to do this because it works. They don't have to prove that the science is wrong or that WHO is wrong. They just have to get us to doubt a little bit and, just make it sound like it's really not that big of a deal, like, oh, those scientists are just being alarmist. But, it's sometimes I start to believe, especially with what we've seen like from the smoking and tobacco industry. I mean, it just kind of seems like anything short of you just literally dying the moment that you take a sip, that anything short of that is alarmist, right? And that just selling more stuff is all that really matters. It's not just this myth that the research is conflicted and that it's all confusing. It's not. It's really not. The data is actually very clear about what is a diet that promotes your health, that supports your health, that keeps you healthy. It's very clear. It's just that we are getting these, purposefully bad faith research, and we're getting media that will cover some of this research that's even kind of questionable, because it sells magazines, because that's what we want to hear. Good on some of these media outlets, like the Washington Post, that covered this campaign by American Beverage to try to get people to question World Health Organization. But that seems pretty rare, and I guarantee that most of you did not hear about that, but you probably heard about butter is back and the case for eating butter. So yeah, it's a sad state of affairs that we think that nutrition information is conflicting. It's not. Um, and again, I think all of these myths have just kind of been perpetrated upon us, because there are, um, there are interests at work that don't benefit if you are healthy and you're eating a simple diet that keeps you healthy. So yeah, I know these are all kind of like a Debbie Downer situation. But the good news is, like, once we know, right, then we can do something else. One of the best quotes I've ever heard is, without awareness, there is no free choice. So now that we're aware, we can make choices. Anyway, I hope all of that is reasonably helpful, and we'll talk more on Get Out of Your Own Way podcast.